Picture a curious 8-year-old hunched over a chemistry set, mixing compounds with the focused intensity of a scientist. Fast forward decades, and that same curiosity about how things work would drive him to investigate some of the most fascinating disease outbreaks in the United States. Everything from anthrax letters that terrorized America after 9/11, lead poisoning ravaging children in St. Louis, and in 2022, a monkeypox outbreak spreading through New York City with official health messaging that he believed was dangerously wrong. For 23 years, he worked as a detective, but not the ones that you're familiar with from your favorite TV shows, but as a disease detective, tracking down the sources of mysterious illnesses, connecting the dots that others might have missed, and protecting public health from the shadows. This is the story of how a childhood fascination with chemistry became a calling to protect millions of people, and why sometimes doing the right thing means risking everything you've worked for. From PHI Media, I'm LaShawn Benedict, and joining me for a conversation is someone who has dedicated his entire career to protecting public health, Dr. Don Weiss, an epidemiologist, former NYC Health Department Surveillance Director, and author of Disease Detectives. Our conversation begins where many scientific careers do, with curiosity, experimentation, and yes, a little bit of danger.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
Hello and welcome, Don, to the Public Health Insight Podcast.
It's a pleasure to be here with you.
You once mentioned and described that your dream job was a bench and Bunsen burner type of chemist. What first kind of sparked that love of chemistry?
Yeah, well, I think early on in life, I realized that everything in life is chemistry.
Yeah.
The fact that you're breathing, that you can move your muscles are all chemical reactions. And I did get a chemistry set for my 8th birthday. And so I spent lots of hours playing with that, made my own gunpowder when I was a teenager.
Wow.
It was something that really sparked my interest.
Well, that's fascinating. And that kind of resonates with me as well because I actually did my first degree in biochemistry. So I could definitely relate to those experiences. And I think there's a lesson there that maybe parents should potentially buy kids some of those chemistry sets to spark their interest in science early on.
Yeah, I don't think they have the ingredients to make gunpowder anymore.
I was about to say.
And I never did anything with it. Gunpowder, unless if you don't compress it, it doesn't explode. It's just sort of like, it's more like a sparkler.
What fascinated me was I used to go to the dollar store and they used to have those fake guns with those little gun caps. Yeah, the gun caps. And we used to just have so much fun with those. I don't even know if they sell those anymore, but that was really fun.
Yeah, I think they were mercury fulminate. It's a contact explosive. That was another interest of mine. I had a professor in college, first day of class. He took this yardstick and tapped the windowsill. And everywhere he tapped, it exploded in a puff of purple smoke, which was nitrogen triiodide, another contact explosive. So that was another thing that stimulated me to go, this is a pretty cool subject.
Okay. Well, speaking about kind of that chemistry and the biochemistry piece, you were asked to actually synthesize phosgene, which is a World War I nerve agent. And you basically hesitated a bit there. And can you kind of tell me about what was kind of going through your mind there?
I got a job working for a chemical company that made herbicides. I was using phosgene to synthesize a herbicide that they wanted to send out for testing. And so I did that in the hood.
Yeah.
We did small scale stuff. We made a few grams of things. That was what we were set up to do. I will note that my mentor, the PhD chemist who ran the lab that I worked in, he took off that afternoon. He didn't want to be around in case I made a mistake or anything, which didn't instill a lot of confidence in me. But that went well. I made the compound. Where I ran into trouble is after I made, it was probably 4 or 5 grams of it. They came back to me a week later and said, great, now we want you to make 2 pounds. I said, 2 pounds? isn't that what the
Yeah.
pilot plants are for? And they said, if you don't do it, we have no choice. You either fire you or you resign. So I resigned. And then, fortunately, 2 weeks later, I got into medical school.
Oh, okay. Well, there's that. You mentioned going to medical school, and we'll get there for sure. But at some point, I read that you left grad school to care for your mother as she was battling cancer. How did that particular chapter reshape like what you wanted for your career and life in general?
Yeah, so that's a story that is really difficult. My mother kept her illness from her 4 kids. And I remember I was a senior in college when I found out, and I called home. And my older brother was still there. He was between college and law school. And he just said, Mom's doing better. And I said, Mom's doing better? What do you mean? And evidently he knew, but I didn't know. And so that was the spring before I graduated. I went on that fall, and then my mother got progressively worse over that winter, such that in January, she was put in hospice care, and she didn't like it, so she came home. And my grandmother, who was in her 70s at the time, was taking care of her. And I wasn't really happy at Yale. Organic chemistry I loved, but being a graduate student wasn't really connecting. I didn't connect with it.
Right.
And I had a younger brother who was 14, and my father, but fathers at the time were providers. They came home, they mowed the lawn, they sat in a chair, they didn't do much anything else. So he wasn't really going to be much help. So I decided, for the sake of my brother, that I'd come home, and it wasn't much longer after that, but my mother died.
Yeah, sorry to hear that. You did mention your interest and your eventual getting into medical school, but it seems that in college you actually steered clear of that cutthroat pre-med crowd. So what actually convinced you to finally circle back and pursue medicine after all?
Yeah, this may resonate with some of your listeners. I was a very stubborn kid, very independent. I didn't do things that other people did. I just kind of did what I wanted to do. And so my mother wanted to be the physician, and that was enough for me to say, well, I'll find something else because I'm not doing what she's telling me to do. But I had a couple of close friends from college and from high school who were in medical school during those years. And in talking with them, I always wanted to do something to help society. All that kind of conspired to say, you ought to give it a try. And then, being perfectly honest, I was fearful of rejection, as a lot of people are.
Yeah.
I mean, I didn't want to, my cousin applied to medical school and didn't get in. I didn't want to have that same tag, well, you didn't get into medical school. So I had to fight back that sort of fear of failure and say, look, if you don't try, you'll always regret it. So yeah, that's what motivated me to give it a try.
Okay, great to hear. And then after completing your medical school, out of all the specializations you could pick, it seems like you went into pediatrics, and you subsequently went on to work towards treating kids in the Bronx, emergency rooms, and homeless clinics. And overall, what did that teach you, and why were you interested in the first place?
Well, one of the things that I remember from my childhood was that the society is not set up for kids. If you look at most water fountains, they're like up to here. Kids can't even reach them. And I worked for a number of years as a camp counselor. So I always enjoyed, I had younger brothers, 2 younger brothers. I always enjoyed spending time with kids. And of all the specialties that I went through, in medical school, you rotate through all the specialties, OB, surgery, internal medicine, psychiatry. It was the one that clicked with me. So that's how I ended up in pediatrics.
It seems like you went on to kind of work in the Bronx in the emergency rooms. How did that kind of experience go, and what did that teach you?
Yeah, I think I credit my mother for most of my moral position. A lot of what she taught us was that you're fortunate to have what you have. Not everybody has the opportunities you have. And she never said it in that way, but certainly the impression we were left with is that doing societal good was not only a good way to help the world, but a career. So I decided that I was going to do underserved medicine, whether it was in the Bronx or some other location. I was going to go where physicians were needed. The emergency room was where I started because I had a job there during residency. I was a moonlighter. And then while I was looking for something in homeless health care, that's what I did. And then a year later, an opportunity opened up working on mobile medical units that provided health care at homeless shelters in New York City.
Okay, amazing. So Seems like you worked in the emergency rooms for a bit. You worked on mobile health clinics. And then at some point, one of your colleagues had mentioned, I'm tired of treating society's problems one patient at a time. And how did that line push you towards maybe sort of public health or epidemiology?
Yeah, so we had to go back to medical school. I had a professor of epidemiology, Donald Loria, who has since passed away, but he was a well-known tropical disease expert.
Yeah.
And he taught us about the 3 types of prevention: primary, secondary, tertiary prevention. And that made a lot of sense to me. This country spends a lot of money on what's tertiary prevention, cardiac surgery, lung transplants, kidney transplants, when the most efficient way to deliver medicine is by primary prevention, which means that you educate people not to smoke, to have good diets, to exercise regularly.
Let's break down what Don just explained, because this is fundamental to understanding public health. Primary prevention means stopping diseases before it starts. Things like vaccines, nutrition, and healthy lifestyles. Secondary prevention catches diseases early when they're at the most treatable stage. Think cancer screenings like mammograms or colonoscopies. Tertiary prevention manages existing diseases to prevent further complications, like cardiac rehabilitation after a heart attack, things that you might go to emergency room for. Here's the problem Don identified. Our healthcare system is heavily weighed towards tertiary prevention, the most expensive kind. We spend enormous amounts on heart surgery, cancer treatment, and managing diabetes complications, when investing in primary prevention could prevent many of these conditions entirely. It's like buying the most expensive fire trucks instead of installing smoke detectors. You definitely need the fire trucks to be ready, but you can also save more people if there are smoke detectors in places that they should be.
If you do those things, you won't need the more expensive care down the line. So that was in the back of my brain. Plus, I was a kid who always liked math, and there's a lot of math in epidemiology. So that was somewhere just hanging out there. I'm going to pursue this at some point. And then when I was at an asthma conference, when I heard that, I said, well, wow, that really makes sense to me.
Your actual epidemiology training, like what did that look like? Did you pursue a formal degree? Did you take some classes?
Yeah, so the woman I was dating at the time moved to St. Louis, and I went with her. And it was fortunate because the University of St. Louis had a program that was geared to professionals who were working full-time. So I was able to pursue a MPH degree in epidemiology, going nights, Fridays, and weekends. So yes, it took 3 years because there was, a couple weekends here or there. But yeah, that's how I moved in. And then after that, I got my first job in public health at the City of St. Louis, Department of Health.
Wow. I mean, that story just goes to show, like, you could be a working professional and also pursue, albeit with a lot of effort and hard work and sacrificing weekends, to pursue something that you also are passionate about. So it's great to hear that and all the hard work. And sure, it took 3 years, but I think that doesn't really matter because you're able to still do what you want to do and you're pursuing your passion in different ways. So I appreciate that, and I could definitely relate to that, doing my doctorate of public health program alongside working currently as well. So it's nice to hear that. So St. Louis, you mentioned. I'm not the best with U.S. geography as I'm based in Canada. You mentioned you had a job there, but at some point you transitioned back to New York. You made this very clear transition between clinical work and going into epidemiology. And yes, there's a lot of relationships there. What was it about epidemiology? You mentioned your love for numbers, but what was it about epidemiology that kind of scratched that itch that maybe clinical work couldn't really do for you?
It was more of a gradual transition. So while I was working at the health department in St. Louis, I was also doing volunteer work at one of their health centers.
Yeah.
And that was until the end of 1999 when I moved back to New York. I think there were two things. One was what we said at the outset, was about having the greatest impact on population health. In St. Louis, I was working on lead poisoning, which is extremely high, and rampant in certain sections of the city. And that was an environmental justice issue as well, because it was housing. It was all related to lead paint in housing. And the other thing about epidemiology was solving puzzles. There's a large interest in podcasts that are true crime podcasts and solving mysteries. And I was always a kid who was taking things apart, trying to figure out how they worked. I had a little trouble putting them back together.
Yeah.
But, that was what motivated me to try to solve problems.
And so that kind of curiosity, I believe, led you back to New York City, and you worked for the health department there. And particularly what I wanted to highlight was the Mpox outbreak and some of the outbreak details and the response from the health department, and particularly inside the Bureau. There may have been some conflicting messaging that the Bureau was putting out there, but I want to hear from you, like, when did you first realize that official Mpox messaging maybe was out of sync with some of the data that you were seeing?
Yeah, we're starting backwards. But yeah, the Mpox was the last big outbreak that I worked on.
Yeah.
And we were first hearing about cases in Europe and Portugal and Spain. And it was clearly evident from the epidemiology this was circulating in the MSM community. There was very little doubt about that right from the outset. And while monkeypox had not historically been communicated sexually, there was evidence in the literature that I was able to find later that did support that. So we had that suspicion right from the beginning. And then as soon as there were starting to have cases in New York City, we were hearing directly from clinicians about where the lesions were, how they were related to sexual activities. And it just supported what we already suspected, that this is being sexually transmitted. But there was a grave reluctance on the Department of CDC and therefore other health departments. Well, I don't know about other health, but certainly in New York City, not to stigmatize the gay community. And there was definitely a foundation for that, with the HIV epidemic. But it fell short in that they weren't getting the information they needed to protect themselves. And that was the issue that stood out in my mind.
Dawn mentioned MSM. That's men who have sex with men, a definition that is important for disease tracking and prevention messaging for target audiences. The Mpox, or previously monkeypox, outbreak that Dawn describes was part of a global emergency and declared an imminent threat to public health in New York State. What Dawn is describing isn't just about one disease. It's about a fundamental challenge in public health. How do you provide accurate, life-saving information to vulnerable communities without stigmatizing them? The HIV/AIDS crisis had taught public health officials to be extremely careful about messaging that could increase discrimination against LGBTQ+ communities. But as Dawn saw it, being overly cautious was potentially putting lives at risk. Walk us through that moment when you perhaps decided to speak to the New York Times, and as you're kind of talking out about this publicly, what were some of those risks that you were weighing?
Yeah, I remember it exactly. Friday at 4 o'clock in July of 2022, I believe, around the 17th or so. I don't remember the exact date. 4 o'clock, we get an email, and it was a blast email that went out to everyone in the health department. It was just sharing with us the press release that had just been issued by the commissioner's office, sharing information on monkeypox. And although it kind of danced around the issue, it used this language that had been circulating for about a month or two that the public health community had roundly denounced as being confusing and incorrect. And the line was something to the effect, I mean, it's in the book, but something to the effect that if you're going to have sex, keep your clothes on, that's going to prevent you from transmitting monkeypox. Because the assumption that CDC was propagating was that it was contact with the sores, the pustules that would be on your body. And we strongly believe that the viruses was present in semen, like Zika was, like other viruses were, and that you could have lesions that you couldn't see inside the rectum and other locations that were transmitted. Because what we were seeing is individuals with horrible, now I didn't actually see these patients, but I saw the photographs and heard the stories, horrible proctitis. That's an infection of the anal canal. At that point, I checked with my colleagues and said, am I overreacting here? And none of them were. And now the backdrop to this is I had previously on multiple occasions at our incident command meetings. That's where the entire leadership of the health department meets and tries to make decisions.
Imagine sitting in a room with the city's top health officials. Outside, people are getting sick with a disease that's rapidly spreading. You have evidence that the official guidance might be wrong, maybe even dangerous. You've raised your concerns multiple times, but you're told to stay in your lane. What do you do? Don faced what ethicists call a classic moral dilemma. As a civil servant, he had the duty to follow the chain of command, but as a physician and epidemiologist, he had to take an oath to first do no harm. When there is a conflict between those two obligations, which one wins? This wasn't just about Mpox. It was about the fundamental question of whether scientific evidence should drive public health policy or whether political considerations should take precedence.
I had advocated for better messaging.
Right.
And I was kind of pushed to the side, said, oh, no, we're handling it. And so I said, okay, this is not really my job to communicate to the public. In the incident command system, everybody has a specific job, so I sort of went back to my job. But then when this came out, I said, look, these people are just failing miserably. Yeah. This is a danger to the public health. And I felt the responsibility to speak to someone. And I thought the quickest way to get the message out was through the media.
Wow. Yeah. And it kind of illustrates, when we're learning and talking about and practicing about public health communication and risk communication, it always highlights a couple of core attributes, right? You have clear communication, be concise, and one of the ones that stand out here is just transparency of what you know and transparency of that information. So something in you really stuck to that piece, that transparency piece, to make sure that folks in the community actually knew what some of that guidance should be. And you took it upon yourself to make the decision to go to the New York Times, despite what that could potentially do to your affiliations with a given organization like the health department. So after that story ran, was there any consequences? Were there any penalties? How did your colleagues respond to that?
Well, let me just back up first. So there were two parts to that. I saw that people were being injured. Mm-hmm. And I felt that the communication, the second part was that we were hearing from individuals and from the gay community that they weren't told what they needed to do. Yeah. Their doctor didn't tell them. There weren't community messages that were coming out saying, listen, we think this is transmitted by sex, so factor that into what decisions that you make. Right. And wearing a condom probably wouldn't help because there were other, body sores and things. Yeah. So those were things that motivated me to act. Yeah. So, I'm a person that, because of my liking of math, I'm always thinking, well, what are the possible outcomes and what are the probabilities of each outcome? And then how to use that to gauge how I make my decision. So I knew that as a civil servant employee, I wouldn't be easy to be fired. Mm-hmm. Now, they could probably do a lot to me and maybe suspend me. There's nothing in writing that the health department says that I couldn't talk to the media. It was sort of an unwritten rule that we all abided by. Mm-hmm. But I thought that it was necessary. It was I felt like a whistleblower. Yeah. That I saw something that was going on that was wrong. I tried internally to correct it. It wasn't happening. I saw no other way. And I think a lot of good came out of it. In the book, I detail all the articles that came out, mostly pro this position, especially from the gay community, saying, hey, look, we're not children. Tell us what we need to know. We'll make our own decisions. Yeah. We don't need you to clamp down on our sexual activity. That's not your job, and we weren't trying to do that. We just want to give you the information to make the decisions yourself. So what happened was that within a week, I was transferred out of the Bureau of Communicable Diseases, where I'd worked for 22 years, to a bureau that neither asked for help nor apparently needed any help. And it was in a different building. They just wanted to sort of shelve me away where they could forget about me.
The consequences were swift and unmistakable. After the New York Times article was published and the impact of that reverberated throughout the health department, Don was transferred out of his position as Director of Surveillance at the Bureau of Communicable Diseases. After 22 years investigating disease outbreaks, the work he was trained for, the work he loved, he found himself in a different bureau, in a different building. doing work that, as he put it, neither asked for help nor apparently needed it. But here's what's remarkable. Don's concerns weren't dismissed by the broader public health community. Many in the gay community rallied behind his call for more transparent messaging, arguing that they deserved accurate information to make informed decisions about their health and safety. Perhaps the vindication came later when both the CDC and World Health Organization updated their guidance to align more to the evidence that Don was also using to advocate. But by then, as he noted, much of the damage has been done. The question remains, how many cases might have been prevented with clearer, more direct communication from the start? Wow. You mentioned that as part of some of these outcomes, I know some were maybe unexpected, and then there was a lot of kind of work supporting some of those guidelines and evidence pieces that you wanted to share out to the community. And I'm sure you were probably validated when you saw the World Health Organization also put out some supporting information to support your stance on this.
Yeah, both CDC, it was probably closer to maybe July or August, a couple months later, that both CDC and the World Health Organization, they wouldn't come out right and say this is a sexually transmitted disease, but that was nuanced. That was, language, whether it was being transmitted during sex or sexually transmitted. And the virus had been found in semen by that point.
Yeah.
So yes, it was a little late. I think by that time, the damage had been done.
Yeah. Well, what a story, eh? There's so many components there. I mean, like I mentioned, the public health communication, the kind of whistleblower stance that you took, and you've seen some outcomes from that. I mean, honestly, like as a public health professional as well, it's so great that we have individuals like you who are willing to take professional risks in light to kind of maintain those ethics and transparency pieces so that you could support those people that are getting injured by Mpox. Even though there are, like you mentioned, some consequences to that decision, I mean, you did your part as a public health professional, transmitting that information in a way that was ethical, concise, and transparent. So
I appreciate you saying that. Thank you.
Yeah, thank you. So I know you mentioned that we were kind of at the tail end of your story at the health department with this story, and you mentioned you have over 2 decades of experience at the health department, and you've lived a lot of these stories beyond Mpox for decades. So with all that experience and decades of experience in epidemiology and investigating different diseases and chemicals that affect the health of our communities, why sit down now and write Disease Detectives, your book? And why is 2025 the right moment to release it?
Well, some of these are more structural.
Yeah.
You're not allowed to write that book while you're working at the health department. So I had to wait till I separated from the health department to write it. And I had been all along keeping good notes so that when I sat down to write it, it wouldn't be that difficult to write. And so it came out in 25 because I started to write it, after I separated from the health department. So it took a couple of years to put it all together. I think it's fortuitous to be coming out at this time. As you know, public health has been attacked since COVID.
Yeah.
And I think that attack has only got more intense with the political climate here in the States. A lot of funding is being reduced. People are being fired from CDC.
Yeah.
As you may or may not know, CDC funds somewhere around 50 to 60% of state and local health departments. So if the funding goes away from CDC, it also goes away from state and local health departments. And I don't know how much of your viewers know this, but I think a fair majority probably realize this. But over 90% of the public health work happens at the state, city, and county level. And while CDC is the agency that gets most of the headlines, the actual day-to-day work is being done by workers there. And that was the main reason for writing this book, is to highlight the work that my colleagues were doing. And in each chapter, you'll learn about one or more of my colleagues who were instrumental in doing this work. And nobody knows who they are. Nobody knows their names. But I wanted to give them credit for the work that they do.
Wow. Yeah. No, I mean, it's a great way to highlight the work. Oftentimes, what I find in public health, we do a lot of the prevention works, and oftentimes there's not a lot of credit given to the prevention piece. So,
If you do your job, nobody knows it.
exactly. Yep. Exactly. Don makes a crucial point about public health that most people don't realize. While the CDC gets the headlines, much of the real work of protecting public health happens at the local level, in city and county health departments across the country. These are the epidemiologists who investigate food poisoning outbreaks at local restaurants, track down contacts during infectious disease outbreaks, and monitor environmental health hazards in the community. They're the ones who, as Don puts it, if you do your job, nobody knows it. When there's no outbreak, when diseases are prevented, and when communities stay healthy, that's success. But it's an invisible success. Don's book, Disease Detectives, shines a light on these fascinating investigations and some of the unsung heroes that help to crack the cases. And the timing couldn't be more important. Public health funding is under pressure, and the field is facing unprecedented challenges. But as Don's career shows us, the work of protecting population health is as vital as ever. So I want to transition there a bit, and we'll go back into the details of the book in a second, but I wanted to transition into the Insight Blitz section that I mentioned. So are you ready for a little rapid fire here?
This is going to be like a Rorschach test. I'm just going to tell you what I think right off the bat.
Yeah, that's right.
Okay.
That's right.
Fire away.
Amazing. So welcome to our rapid fire segment called Insight Blitz, where we ask you questions or read some statements, and you provide a brief response. So let's begin. What's a skill you learned early in your chemistry days that you used as an epidemiologist?
Patience.
Tools that exist now that have transformed the efficiency of investigations that weren't around 20 years ago.
I would say wastewater testing is one that comes right off the bat, but I think a lot of the molecular laboratory techniques.
Right. A hot take you have about the work that you do that might ruffle feathers, but you're standing by it.
Put people's health over politics.
Yeah, very important one. So you're a coach at college basketball. What coaching mantra secretly doubles as perfect advice for rookie epidemiologists?
I teach epidemiology at the university, but I'm working as a college coach year-round. Right now we're recruiting, and we run our kids' camp starts on Monday. I think the thing that I try to impart most to players, which would be the same thing I would impart to epidemiologists, is confidence. I think that's a key feature that a lot of young people don't have, but it's extremely necessary for success.
Thank you. And the last one here, from chemistry lab to hospitals to clinics to health departments, classroom, academia, what is the worst piece of advice that you've gotten?
Worst piece of advice that I've gotten? I think you may have stumped me there. Well, I think this goes along with the confidence issue. Yeah. I think, and it's more of a general response, is when people tell you you can't do something.
Yep. Okay, well, that brings us to the end of the Insight Blitz segment. That wasn't too bad, was it?
No, that was fun.
There we go. Thank you. Amazing. Dr. Don Weiss reminds us that public health isn't about statistics and policies. It's about real people making difficult choices to protect their communities. His journey from a curious kid with the chemistry set to a whistleblower willing to sacrifice his career shows us what integrity looks like in action. Coming up next, we'll pull back the curtain on how disease detective work actually happens. Don will take us inside the New York City Health Department and why New York City is considered the epicenter for outbreak work, and really walk us through the systematic approach he refined over 23 years of investigating mysterious illness outbreaks. That's next time on the Public Health Insight podcast.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast. your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.